Yeah, Uncle is in the house. Uncle is in the house. I can see. Let me see what is happening. Greetings to you, Dr. Benjamin, in the stream, live, like, and welcome, Uncle. Welcome to the live stream. Welcome to the live stream. Everyone who is watching. I'm just popping in. It's a Sunday day, and I'm in the house with everyone. Big up everyone. Big up everyone that is watching. Big up everyone that is in the house. I hope everyone is doing good today. It's a Sunday. You know, Sunday is a day that you relax, chill, and feel yourself, and feel that you are here and everything is cool. So guys, my guys, welcome. Today is a random question about normal health conditions. Oh, the Coffee Cakes is here. Hi, Coffee Cakes. I can see you here. I can see you here. Coffee Cakes, you need to talk to me. I gave you a text on your Instagram. We need to talk. And hope you are doing fine. Today is a Sunday. And due to fatigue, I found myself drowsy. I've slept. I've really slept today. Yes, we do. Yes, we do. We really need to talk about it. Because, you know, I like everyone being okay. Let's talk about normal dosages of over-the-counter drugs. The normal drugs that we know, over-the-counter drugs. Let's talk about the normal dosages of over-the-counter drugs. The drugs that you go on the counter, you buy and you take without a doctor's prescription. Normal dosages of over-the-counter drugs. If you are coming in and you're a new person, you have to dial the subscription code, subscribe to the channel. Let's link up. Let's link up as we talk, as we connect. It's a Sunday evening and we don't have a complicated topic today. We just talk with my friends like Coffee Cakes, Jovek, and Uncle. And if you are new, come to the chat. Tell us where you are from. Tell us where you are chilling from. Let's welcome you to the chat. Be our friend. Let's communicate. Let's interact. You see, let's talk about normal dosages of the drugs we take, normal dosages of the drugs we take, Let's talk about them, Sometimes you have to feel, I have a headache. Instead of going to the doctor, you go over the counter, you get a drug you take. There are some dosages you should take, and even the drugs that we use, the normal drugs that you use, they have a limit. They have a limit, because if you take a lot of paracetamol, because it's the normal one that people use so much, what do you get? You will get toxicity. You will get toxicity. You get it? So let's talk about it. Let's talk about these drugs that we usually take. These drugs that we usually always take over the counter. Let's talk about them. Is that like Tylenol here? Yes, Tylenol. There are many brands that we take over the counter. The companies' names are very different. Here we have Citamol, we have Curamol, several brands that we take. Let me see your Tylenol. Tylenol is paracetamol. And let me see. Yes, it is acetaminophen. It is paracetamol. So these drugs that we take normally, typical doses for adults. This is Judy. Judy, welcome to the platform. I see you there. Normal dosages, and I will be talking about dosages plus the effects that they have to a person. You see, dosages plus the effects that they have. And Brufen, what is yours? Oh, there is paracetamol and there is brufen. Those ones are two different things. Paracetamol is also called acetaminophen. The molecular Miriam Mumbwa, welcome to the platform, and let's get to know you. I can see so many new guys watching me today. If you are a new person, text us, tell us hi. Knowing you is a good thing. Don't just watch and keep silent and go. Yeah, some people come watch. I've noticed some people watch me for so long without speaking, and then one day a person tells me, Doc, I've been watching you for so long, let me subscribe today is your day to subscribe. Today is your day to subscribe. So ibuprofen is like a devil here. Ibuprofen is not a good thing, let me tell you. The first thing it gives you is acidity. You get a lot of acid, you get your stomach pain. I like paracetamol more than brufen. Brufen is in the class of drugs called NSAIDs, non-steroid. Gives you more acid. Now, welcome everyone. Welcome Miriam, welcome Jamaican Uncle, welcome the Coffee Cakes, welcome King Ray, welcome everyone who is in the house. Big up everyone that is watching. Now, which drug do you like using over the counter? Ladies, I know ladies are fond of this. Most drugs that you use, they have some side effects, and those side effects are not good. And these drugs are over the counter. Let's talk of paracetamol. Paracetamol, when you buy it, the normal dosage for an adult, an adult can take up to 500 to 1000 milligrams every 4 to 6 hours. MR, Miriam, you use MR. You know MR. MR. I think you are talking about Zulu MR, Diclomol MR. There are several muscle relaxants that are combined. Miriam, now you are using 3 drugs in one drug, and it relieves you so fast, and then you feel relieved. Zulu MR has aceclofenac, has paracetamol, and the other one, which is called, let me see, we have so many drugs that are combined. Let me see the combination of Zulu MR. It will relieve you so faster, but if it's a person that having clozoxazone plus now, in that tablet, whatever that is giving you muscle relaxant is the clozoxazone. You get the clozoxazone. And takes pain away but damage my tummy. I was on 1600 milligrams a day for many years. Wow. Please stop using brufen if you have problems in your ulcerations in your body. Leila, I wanted to call you today. The problem is, when I got home today, I wanted to come to the office, and then I started dozing off, and I dozed off till now 5. I dozed off. So I'll call you Leila today. We talk. Leila is sometimes when I talk to Leila, I feel like I'm talking to my sister, and I feel good when you talk to your friend and you feel that you are talking to a sister. You feel nice. You see, Miriam Mumbwa. Now you are using paracetamol 500 plus muscle relaxant, which is clozoxazole. 3 drugs in one. Zulu MR, aceclofenac, a class of drug that is in NSAID, like diclofenac, and paracetamol and clozoxazole. Those are the drugs you are using when you are using these drugs. Now, what happens to brufen when you are using brufen? Welcome, my guys. As you come in, double tap on the screen. Let's get those likes. Let's get those pimping up. Let's get those drugs that you usually use. Double tap and like as we continue. Now, let's get to know the common drug, brufen and paracetamol. I'm happy you rested, dog. We shall talk. Leila, I dozed off. Don't play with something called fatigue. Helps with inflammation. Brufen. Corrosion. It helps with inflammation, but we know when it stops prostaglandins, which are a mediator of inflammation, and inflammation helps your body to recover. Leslie Ann Hunter, having heaviness in the head and memory loss. Heaviness and memory loss in the head. It means you can be having acute head injury. Leslie Hunter. Hey, Leslie, welcome to the platform. I know you are a new guy here. Which side are you at? Leslie, which side are you chilling at in this world? Are you from the US, Africa, Asia, Russia? Tell us where you are chilling, Leslie. We interact, you see? Having heaviness in the head and memory loss. That is direct. Jamaica, land we love. Ooh, I met a girl this morning. He was at first, that one praises Jamaica, light from Chronics. Now, Leslie Hunter, heaviness of your head and feeling I had an head injury. Now you need diuretics. You need drugs that are called osmotic diuretics to relieve the brain pressure. And subscribe to the channel. Leave me a message on any of the videos, or this one. No, not this one. This one will come after. On any of the videos or shorts, then I'll take you through how you can relieve headaches and some problems that you have in your head. But welcome to the channel. Be part of us, Leslie. I know this is your first time here. Today is a Sunday. We talk on easy topics like this that I'm talking about. Now, when you are talking about when need and financial break, yes. Oh, okay. I've not understood that, but rephrase it, I understand. There is something I want people to know about Brufen. When you take Brufen, you will have burning stomach, heartburn, acid reflux, nausea, indigestion, stomach ulcers, bleeding. You see, why it happened is because Brufen belongs to NSAID. This drug reduces the protective layer of your stomach, the mucus layer of your stomach, and in the stomach, making your stomach have more acid. Taking that drug more, Brufen, and taking diclofenac and aceclofenac that is in Zuluemard that Miriam uses in high doses, it will make you have a very bad ulcer. When you reduce the layer of your stomach, protective layer, you will get an ulcer. So when you want to reduce after you have taken Brufen, what you wanna do, take it with food. It is something that you don't wanna take every day. If you have chronic pain, ask your doctor to give you another drug that is not Brufen or diclofenac or aceclofenac. It will ruin your stomach. It reduces the protective layer of your stomach, the mucus layer of your stomach. Now, let's talk about the other drugs. We have talked about paracetamol. The normal dose should be 500 to 1000 milligrams every day, 4 to 6 hours. 4 to 6 hours. Maximum dosage should be 4000 milligrams per day. 4000 milligrams per day. But before it gets to 4000, that is a dose that a doctor can give. For a person who is at home, make sure oral steroids damage it too. Yes, even steroids. Now, I'll talk about steroids again. We are heading there. If you are at home and you're using paracetamol, please use 500 to 1000. If the pain is persisting, go to a hospital. Brufen, always 200 to 400 milligrams, 4 to 6 hours. But I've given you a note about Brufen. It's an NSAID. If you have ulcerations, please stop using Brufen. It reduces your protective layer. It will make an ulcer in your stomach, and you will start eating acidic food. And if you take alcohol, your stomach will burn, my friend, burn like fire. It will burn like fire. Let's talk about aspirin. Aspirin is a pain reliever. How does it do? Some people take aspirin as a pain reliever and fever reliever, and also it lightens blood. It makes blood lighter so that it can flow around your body so well. So aspirin, I usually tell people, unless a doctor has told you, please don't use aspirin. It has side effects because you have this and this. You have problems of bleeding or factors on your body that of bleeding. The aspirin, you should use it between 325 to 650 after 6 hours. But for a normal person above 35, I recommend once in a while you'll be using aspirin, like 75 milligrams 3 times a day. Normally, even if you are good, because it helps your blood to go circulate in your heart and replenish your nutrients value of your well. You get, it can cause bleeding. That one, not. Aspirin can cause bleeding and can be a big problem. Aspirin can be a big problem because if you have tendencies of bleeding, you have beriberi disease, you have reduced of factor 8, you have reduced of something that is called Christmas factor or factor 9, prothrombin, you will bleed. So aspirin, be careful with it. But if you are normal and your life is normal, use aspirin between 75 to 100 or 140 milligrams in a week. Normal person, it's a good thing. It can help you to make your body be well. Welcome, my guys, who you are watching, welcome to this live. Big up every time where you are, every place that you are staying, every place that you are relaxing. This is Benjamin, the wise guy, the guy that is easy. Yes, the doctor that is always easy. We learn as we enjoy. You know, learning sometimes will be enjoyable. You don't learn as you, baby aspirin, the chewable. Yes, I use it. I use the baby aspirin once a day, Dr. Benjamin. Yes, that is important. It makes your blood thin, and then your heart have a good moment when it is pumping blood. The guy who killed a mosquito with a bang, Leila. Whoa. Hey, that is not Dr. Ben Leila. I use the baby aspirin. Uncle, continue doing that. It is helpful to your life and to the health of your heart. You get? If your doctor has said it, please, if you have no any problems of bleeding, you use it. But if you realize you have started having bleeding problems, what is a panga out of? Machete. Coffee cakes. A panga is a machete. A machete. The one we cut in the bushes with. So guys, welcome to this platform. Subscribe every time you are here. Don't go without subscribing, my friend. Why are you going and you have not subscribed? Oh, okay. Yes, like as we go on. So aspirin, we give it at but you know, today is a random question. So ask any question randomly, we discuss it. There are some things that people ask randomly, like Onik asked a very important question and in a live, and it was a discussion one. It brought a discussion. It brought a big discussion that was about what happens to the brain when a person is in a coma, or a person gets how was the question? What happens to the brain when a person is in a coma, or when you lose unconsciousness? It was a very important question, and I explained it. So aspirin can cause your stomach to bleed if you have ulcers. Yes, Dr. Benjamin, my doctor recommended it because of my son's stroke I had some years ago. Yes, important. Jamaican uncle, everyone, if you have in your family anyone who is above 35 years, recommend these people to be taking aspirin once in a while as they exercise. It is important in their life. Allergic medicine, cetirizine, antihistamine. Cetirizine is an antihistamine. When you are sneezing, scratching yourself, feeling that you can do what? Remove your skin. Use cetirizine. You know, when you are scratching yourself and feeling irritable, what is happening is the inflammatory mediators. When you have something that is happening in your body, or you have inhaled something, the lymphocytes come there. So T lymphocytes are natural killers. The neutrophils are the ones which remove the histamine. So when they remove the histamine is a gas. Those cells, when you take cetirizine, they stop that gas to come and burn you. So you sneeze because of the reflex of that gas. You scratch yourself because of the reflex of that gas, the coming out that is burning on that gas. Yes, Onik, how is the going? Yes, Onik, I know today you are a happy man. Onik today is a happy man. He's feeling very nice. Why? Because yesterday Fiona said Fiona apologized to Onik. I'm good. Good, thanks. How are you? I'm fine. I am happy. Yesterday Fiona apologized that it was a mistake. She didn't block you. It was a mistake, and I think Fiona likes Onik too. Onik, please organize you come to Uganda. I'll take you there with Fiona, and don't hurt Fiona, man. She's a gentle girl. Fiona is a gentle girl. So if you organize, you fly to Uganda, be sure I'll take you there. Onik is a good guy. We love Onik. Coffee cakes, yes. Histamine is a gas from the neutrophil, the cells of immunity of your body. They are the ones which releases that gas, and then you get a reflex, or you feel like you can scratch your body all through. But sometimes when you get antihistamines, you can get drowsiness. So in a day, you can take 20 milligrams. Adult dose is 10 milligrams of a tablet, but for a child, you usually know it is 5 milligrams. When you have a lot of running nose, and you have a lot of scratching yourself and feeling, you need to take cetirizine. That is an over-the-counter drug. It's an over-the-counter drug, and we have something that is called loratadine. So my guys, if you are here and it's a Sunday, you are chilling in the morning, you don't want to go to church, or you are preparing to go to church, welcome to the platform. And always be easy here. I'm easy. You ask any question that you want. Ask Mumbwa, like what? Tell me what. Like, I've passed that. Miriam is a cool mom. Miriam is a cool lady. No big deals. Very cool lady. A lady that always is with no problems. No problematic. Comes to a life, smiles, does some things without a lot of worries. That is Miriam Mumbwa. Say, Miriam Mumbwa, what about like? Say it, I'm waiting. Now, loratadine is also an anti-allergy, just like cetirizine. These are things that stop some. I'm doing on it about you. These are things that stop some cells, like mast cells. Mast cells release some inflammatory mediators. Mast cells are in your nose, and they cause some inflammation. So when you take loratadine, they stabilize the mast cells not to bring problems. So that you get a stuffy nose. When you have stuffy nose, it doesn't mean that mucus are blocking inside. It means the airway is inflamed and it is reducing the airflow inside. That is a stuffy nose. Some people say, I have so many mucus until my nose are stuffed. No, you have reduced inflammation, my guy. You have reduced inflammation. You have excess inflammation, sorry, and the airway is getting inflamed. Which drug do you like using? No, men, as men, we don't use drugs. As we get headaches, we stay with it until it gets away. You feel like you have flu. It hits you until you are okay. As men, I know ladies are the ones who love drugs sometimes. A little sneezing to the hospital, a little pain, complaints. And some men too can get there. But let's talk about these things. Let's talk about the drugs that we usually use over the counter. So welcome magoti yangu pain. Miriam is saying my knees hurts. Your knees hurts. You need to go and do uric acid levels and do something that is called rheumatic factor. If you find your rheumatic factor is positive, you know that maybe your family rheumatic factor is positive, maybe your generation has a factor of arthritis. So you start managing it nutritionally. If your rheumatic factor is positive, just know there is no way that you can treat it to get negative, but you can handle them by nutrition and you get well. But if you have gout arthritis, for which I doubt, Miriam, you can be having gout arthritis. Most of the people who get gout arthritis are drunk. Gout is equals to alcohol. So Miriam doesn't take alcohol. You are not in that category. So visit a hospital where you are closely. Let the doctor do those tests, rheumatic factor, and see if you have the nodes, and then you'll be given some drugs. There is a good way. I usually say when you have some systemic diseases, genetic diseases, or systemic diseases, the best way to handle those is by using always be using nutrition moderation. Nutrition is the best cure of every disease that you have. Nutrition, you get. So don't eat a lot of meat, nyama choma. Let's not go to events and then you eat a lot of meat and you know you have some kind of, you manage it, discipline yourself. Now, which drugs do we use, my friends? Which drugs do we use, my friends? Where you are, everywhere you are. When you are feeling that I have a headache, I have this. And women, sometimes when they have what? When they have menses, there are specific drugs they use to relieve the pain. Yes, which drugs do you use and you are used to them? Sometimes, you know, when you are used to some drugs, you can get some problem. You can get some problems of pain in your, you can get some problems of pain after pain. You relieve pain and you are getting pain. You get. So let's see which drugs you use, my friends. Diphenhydramine, itchiness and motion sickness, allergies. Those people that like when you travel you vomit. It is called motion sickness. Yes. Motion sickness is something that can be controlled, but sometimes people use diphenhydramine to relieve the problems of motion sickness, like 25 to 50 milligrams for 4 to 6 hours, 25 to 6 milligrams 4 to 6 hours, and you have motion sickness. When you move, you start feeling like nausea and vomiting. You start feeling like nausea and vomiting. There are some, you can use a diphenhydramine 10 minutes before you travel, and you can use something that is called, this one is called Placid. Placid also helps. The only thing, when I was a kid, I usually had it too. The only thing you need to know with motion sickness is if you want to travel and you have this problem, always don't take anything. Don't eat. if you are traveling, don't eat. First, you can take some drinks, but don't take heavy meal, because if you take heavy meal, what will happen is you will vomit, and motion sickness comes with motility of your gut. So if you are afraid, you can take diphenhydramine like 25 to 50 milligrams, or plus it is called metoclopramide. You can take it like you can take metoclopramide like how many milligrams? Like 5 milligrams to 50 milligrams, according to your weight. Now, cold and cough and cold medicine. Cold and cough medicine. This is where we have problems, especially to children. When you have children, always don't be giving them blended medicine that have additives. Any child under 5 years, take that child to a doctor. But for an adult, we have some dextromethorphan. It helps in dry cough. There are some syrups that are blended with salbutamol. And they can help release the airway. So you become having the airway opens up and you feel relieved. But for children, those ones, please. Sometimes you can buy them drugs over the counter. The only drug that you can buy over the counter and antihistamine, always be using cetirizine. If cetirizine does not work and paracetamol, take that child to a doctor. Some people expose their children to medicine over the counter, and before the child is within a doctor's setting, this child, the medicine that you've given have done worse. Children are not exposed to many things, and their immunity is still working up, the body is still growing, and you are exposing this child to several medicine that can bring problems. Always let your child go see a doctor before getting some medicine. It is very important to do that. Let the child go and see a doctor. Now, let's talk about there is a plant in I don't know, in Asia, that produces guaifenesin. I will find about that plant. There is a concoction and syrups they create. It relieves the airway. If you go to some hospital, one of the hospitals in Kenya is like Aga Khan, they have it, guaifenesin, those syrups. So when you them, they relieve your airway. You can take 200 to 400 milligrams every 4 hours. Please remember to like as soon as you enter. Yes, let's create more So guaifenesin is one of them. Drink plenty of water. Drink plenty of water while using this, or get constipation. Yeah. Now there are some medicines we use for the stomach. The stomach medicines that we use. The ones that treat heartburn, acid reflux, and typical others. When you get an heartburn, it means that acidity is coming back, and you feel your stomach sometimes is burning. You have taken some food that is bringing more acid, or you have taken some drugs that are bringing more problems to you. What will happen? It will burn your stomach. So you need to take something that will relieve your stomach from the acid. So what do you have to do? What you have to do is take some calcium carbonate to relieve the acidity. It is calcium carbonate 500 to 1000 milligrams. This is to an adult. Don't use calcium carbonate to children. No, Use it to an adult. 500 to 1000 milligrams. Use calcium carbonate to adults, not children. The children bones are still growing and you can hurt them. You can hurt the children. Now, what else do you use when you feel like your stomach is oh, Miriam is still here. Welcome, Miriam. Thanks for giving me kikombe. That way it's called, we call it kikombe here. There are some medicine like loperamide. Loperamide, these one are anti-diarrhea. Loperamide, when you buy them over the counter, please consult your doctor first, because there is a times where your diarrhea is best. There is a time where diarrhea is better, and there is times that diarrhea is not good. You need to stop it. Stopping diarrhea sometimes is bad. You need to have it and you rehydrate more. But there is sometimes that you need to stop it. So when your doctor told you, you can buy where you are loperamide, 2 milligrams after each diarrhea, because this one is not a dosage. After you diarrhea, you go for, you drink, you take some 2 milligrams. If you go to the stool, to the loo, you take. Maybe you took some food that is not good and it is harming you, you can use it. You can use loperamide. You can use it for some time. If you see the diarrhea is not stopping, please rush to a doctor to find out what is happening. Diarrhea can make you get dehydrated until you die. You have seen cases like cholera. Cholera, the main thing when it comes to cholera, the main treatment is rehydration. The main treatment when it comes to cholera is rehydration, not even what? Not even the drugs that you are given, because people die in cholera because of dehydration. Fluids, the bacteria Vibrio cholerae. Bacteria Vibrio cholerae gets into your stomach and it activates something that is called CAMP, that makes your stomach not to retain fluids, to absorb fluids. So you keep on diarrhea. So that is about loperamide and rehydration salts. Rehydrating is very important, but you see, loperamide is not a rehydration salt. Loperamide is something that is meant to stop the diarrhea. So if you are here and you feel like you have ever used it, please always consult a doctor. It's better you use rehydration salts like ORS. Constipation medicine, psyllium, constipation, people that are used to constipate. First of all, let's talk about constipation. What is constipation? As we talk about these things, we need to know about constipation. What is constipation? Constipation is bowel movement become less frequent, hard or dry stool, and difficult or painful to pass. Because you have been dehydrated and you are absorbing more fluid, so the stool becomes so hard, even hard to pass. Common symptoms becomes passing stool fewer than every time, hard palate like stool, feeling of incomplete emptying and bloating and abdominal discomfort. Those people that don't like eating foods that have fiber, don't like drinking water, they say that I cannot drink water, I'm not used to drinking water. Stress or change of routine of your eating habits. And there are some drugs that can bring constipation. Drugs like Brufen, drugs like iron tablets and opioids. Iron tablets are like the Ranferon tablets or Ranferon syrup, you understand? And some antacids. They can get you a hard stool. They can make you have a very hard stool. And when you have a hard stool, constipation heats up. So when constipation heats up, what happens? When constipation heats up, having hard stool is not a joke. passing stool, you can have a problem until you go to the hospital to be operated. So Psyllium is one of the drugs that people buy when they have constipation. Psyllium. I know one of the people that is watching, or someone who will watch, have constipation one day in life. Usually one dose mixed water 1 to 3 times must be taken with enough fluids so that you cannot get stomach problems, corrosions. So if you have ever used Psyllium, tell me. You just know the doctor gave you to because your stool was so hard. Your stool was so hard. Constipation medicine are not used. They are not good to be used every time. This is a very important topic when it comes to daily to day life. Constipation. You know, constipation is a problem that is brought by low fiber diets, not drinking enough water, lack of physical activity, ignoring the urge to pass stool, stress or changes in routine, and some medicine that someone is taking. It may not you, but it's a problem you are treating. Most people that you have noticed, some people that when having antibiotics, the results they get is constipation. The results they get is constipation. How can you relieve constipation? You start taking fiber foods. You start taking kales. You start taking kales. Kales are very important to relieving constipation because they have fiber. People say guavas bring problems, but when you take a lot of guavas is when you get problems. You know, you drink more water. Drink more water so that you can relieve constipation. Try regulate toilet habits. Warm drinks can help stimulate bowels. You get warm drinks. Medicine are like lactulose. Lactulose is the best when it comes to constipation because lactulose helps even the hello Cassandra Queen. Hello, welcome to the platform, Cassandra. Thanks for tuning in. Now lactulose helps even the liver in another way. So when you start having constipations, I will advise to use lactulose. But when you use Ducolax or Bisacodyl, you will relieve the constipation, but the pain you will get, the pain you will get. Happy Sunday. Hope you are doing well, Cassandra. The pain you will get, my friend, hey, you will not like it. Before you relieve your stomach, have you ever used this drug? Have you ever used Bisacodyl or something that is called, if anyone in the platform, if you have ever used Ducolax or Bisacodyl, please tell me. I know that one is no joke. Those drugs are no jokes. They will relieve your stomach, but the pain that you will get before you relieve your stomach, is no joke. Now, in constipation, always seek medical care if there is blood in staining stool. Blood in stool. Severe abdominal pain, vomiting, weight loss, fever, and constipation lasting weeks. Constipation lasting weeks is not a good thing. You see, inability to pass gas or stool at all. When you have inability to pass gas or stool at all, it is a problem. You get? So, long-term heavy use of laxatives without medical advice can worsen these problems. You should not continuously use laxatives. I'm telling you, when it comes to stomach problems, let's use always nutrition. Let's take care of nutrition. You see, there are some important safety tips when it comes to medical problems and drugs. Medical problems and drugs. Never mix medicine without checking interaction. Drug interaction is very important. Drug interaction. You are using two drugs at the same time that are interacting. Let's talk about it. Drug interaction problems. You don't use some drugs, and that's why we tell people, please visit a doctor before you use this combination of drug. Drug interaction happens when substance changes the effect of another medicine. You have seen there are some drugs that when you mix before using them, they change into another color or they form crystals. You see, we have some drugs that interact. Drugs interaction. You use drugs that are called non-steroidal anti-inflammatories. Non-steroidal anti-inflammatories, NSAID, plus blood thinners. If you use like aspirin and brufen, you see, increase bleeding risks. You see, the interaction may increase bleeding risk. It is very important when you are using drugs. You go to a pharmacy, you tell them, I'm feeling pain here. I want a drug that will help me relieve my pain faster. They give you aspirin and they give you brufen. Because you want to relieve and maybe you bleed in your gums. They will increase the bleeding tendencies. Drug and food interaction is another thing. Blood and food interaction. Food changes how a medicine works at times. You see, grapefruits juice, the juices that we take, it is very important to be taking medicine with water. Water is the medium that is advised when you are taking medicine. Mostly when it comes to tablets, because those ones are the ones that we use a lot when it comes, we want to take water. You take some what can I say, juices and some atorvastatin collects, and they are called statins. You swallow. They interact. They will not be effective. They will not. It will change the statins. It will not be absorbed. So you will be taking the drug, and it is not effective because it has formed another crystal that is not that drug. So when you want to take some drugs like statins, some drugs that like some antibiotics, always use some medications that are called the medium of fluid that is accepted, that is called water. Don't use juices because they interact with these drugs. Juices interact with these drugs, my friend. You see, this is called drug interaction. We will talk about drug interaction at a whole wide talk one day. People that take drugs and alcohol. Yes, that's why it is recommended to use water. And water, at times also when you take some drugs, it makes the drug active. It brings out the active component of the drug. So if you use something that is not water, it will not bring the active component. Sometimes we let's follow the rules of taking medicine. Let's stop using random ways of taking drugs. You are taking tea with a drug because it's time of taking that drug, and it's in the morning, you have tea or coffee, you take the tea, you swallow it with the tea. You are reducing the potency of that drug to your body. So healing becomes a problem. Let's drug as per needed. Alcohol increases drowsiness, stomach bleeding, or liver damage, and then you are taking a painkiller like NSAID. Interaction between an NSAID and alcohol can bring bad results, bleeding plus a lot of pain, and then the drug itself, because it is reduced by alcohol, it will not be effective. it will not be effective. So let's stop taking drugs with tea. Let's stop taking alcohol when you are being treated. For those that take alcohol when they are being treated, it's a question that we usually get every time. Doctor, can I take my local beer as I take this? Only one. Someone asks you only one bottle, it will be enough. Then you'll be confused. How can I answer this person now? How can I answer this person? A person asking you for a beer and is on medication. Sometimes people joke a lot. Now, NSAID may worsen stomach ulcers or kidney disease and even kidney stones. Now, let's get to know if you've taken some drugs. Even Cassandra is laughing at that. Yes, it's a normal thing. NSAID may worsen some problems, NSAID may worsen some problems. You see, signs of possible interaction are like a rash. You get a rash, you feel dizzy, severe sleepiness, bleeding, stomach pain. You have taken a drug and then you start having stomach pain. Just know it has interacted and you are having that problem. Breathing difficulties. You have taken it and the drug is reacting. So the airway is having a problem. You start having a very problematic breathing because inflammation is undergoing. The products of interactions now, they are reacting to your body. Instead of the drug working, it is the product of interaction that are working on your body, which we don't know. Maybe sometimes we even don't know which food you ate that is reacting. That's why you will find a person has gone to a hospital to get treatment. I put turmeric and cinnamon with Nanteg in my coffee when I'm taking them. Yes, those are nutritional compounds. That ones are nutritional compounds, Uncle. It's not bad. But I usually say if you are taking coffee, just take coffee. Don't add anything. Now, I was saying this is something that most of the doctors undergo. A person goes to a hospital, so nice. A good doctor finds maybe this person had taken alcohol. You have come to a hospital and the doctor is with a good heart, wants you to get better. The doctor gives you some antacids or esomeprazole and some fluids so that you cannot get to, maybe you are diabetic, so that you cannot get to diabetic acidosis. Now, the product of the interaction of the alcohol you took, because you are at a crisis and you are trying to help, brings a lot of histamines to your body there, and then a rash comes and you get like you are burning. Now, when you don't get better, the next thing this person does is he wants to go to police to say the doctor destroyed. He was just well. I was just well when I was going to see a doctor, but now my body when I'm in hospital is bad. I'm burned everywhere. Now you forget that before you went to the doctor, you had some drinks and you went there for help. And when a doctor was trying to help you, you were at a bad position, and what you took, you yourself, is what led you to what you are facing. So when you start having these problems, you start blaming the doctor, and the doctor was, let me tell you about some things when it comes to alcohol. Sometimes people buy alcohol and they don't know the compounds that are making these alcohols. You buy alcohol and you don't know the compounds. You drink the alcohol thinking that you are drinking a good thing. Wait until you get the hospital and then you start getting drug interaction. Welcome, Jamaican uncle. You start getting drug interactions. Then you start saying the doctor did not give you the right medicine. That's why most of the reported cases of patients' complaints in hospitals They don't go anywhere. Because if really you look at I have a question. What happens sometimes if someone uses antibiotic and starts feeling like getting vaginal infection? That antibiotics have side effects. No, antibiotics have no side effects. That is when you take antibiotics, your vaginal infection. Antibiotics treat bacteria. They destroy bacteria. Now, for a lady and even a man, there are some bacteria that are in your skin. There are some bacteria. Coffee Cakes is taking coffee. Where do we get these emojis? I wish I could know where these emojis come from. Well, Coffee Cake, sometimes you make me feel nice. Now, I was talking about I was answering Cassandra. Now, your skin has a bacteria that is protecting your skin. Your skin has a bacteria that is protecting your skin. Your vagina has a bacteria that is protecting there. But it's not at a high level, it's a moderated level. So when you take antibiotics, you are killing plus those antibiotics. Bacteria. You are killing plus those bacteria. They are giving antibiotics for the hantavirus. Why? If a virus. Okay, let me finish with Cassandra. So they kill plus those bacteria that are helping you. So what takes over is a fungus. When you have killed all the bacteria that are helping you to put all the fungus away, you start having a white rash, a white discharge, sorry. The white discharge is a fungus. That is an infection, a fungal infection. So that's why many ladies, when they are given antibiotics, they are also given antifungal, so that it keeps away the fungus as you wait to get better, and the normal floras they come back to normal. That is what happens. The antibiotics that you take destroy even the normal bacteria that you have. You see, they destroy them. So that is how it happens. So, my friends, that was a question from Cassandra. That is what happens, Cassandra. So, if you are, some people don't get it and others get it. So, when you go to a hospital, you tell them, I have this tendency. When I take antibiotics, I get Dr. Ben, hello, and the Coffee Cakes, welcome, forgiveness is narrated. I get this problem. So they'll give you a prophylaxis. We call it a prophylaxis of keeping away the fungal. It doesn't attack you, because if that bacteria is not there, what comes is a fungus. And then here we have a question from the Coffee Cakes. They are giving antibiotics for hantavirus. And it's a virus. Why? Now, Coffee Cakes, when you get a viral infection and it destroys your airways, you start maybe bleeding, or the opportunistic infection that will come through is a bacteria. And then you start suffering both. You start suffering from a virus plus a bacteria. So sometimes it is good to keep away both. You keep away the bacteria and you keep away the virus. And keeping a virus away is maybe you stop the replication process. There is no way that you can keep a virus away. Some viruses, after 2 weeks, the body immunity always destroys them. But some you have to give some antivirals. mostly the viruses that comes and destroys your skin. Some viruses that is how these things happen. These things. So those are the pros and cons of virus and bacteria. If a virus comes and causes harm, a bacteria becomes an opportunistic infection. So keeping them away, you give both. Just like the question that Cassandra has asked, why is it that when I take antibiotics, I get another infection? It is always a white discharge. It's a white discharge because that is a fungus, and the fungus brings those problems. You see. Now let's continue as we were talking about drug interactions, drugs that interact. How to reduce the drug interaction. Sometimes, no, before we go to how to reduce, let's talk about signs of possible interaction. You have taken something and it is interacting and you feel that there is a problem. Getting new rash. After 1 hour or 2 hours have you taken a drug, some drugs that are interacting with something, you can get a rash. Okay, there is sometimes you can be totally dizzy. Sometimes you take a drug and some drugs and you become totally dizzy. Even walking becomes a problem. Severe sleepiness, bleeding, stomach pain, breathing difficulty, irregular heart and confusion, and some confusion. Confusion, it means the products of interaction are going to your brain and they are destroying some things. So you need to see a doctor. If you take any medication and you are starting to have breathing problems, please go and see your doctor very fast. It is very important you see your doctor because it can be worse. I've seen some people that are given some drugs and then they have as the skin is burnt everywhere. The skin is burnt everywhere. You see, the skin is burnt everywhere. It is the product of interaction that are burning that person. It's very important to check on these things when you are taking drugs. How to reduce the risk? How can you reduce the risk of interaction? You tell your doctor, the pharmacist, all medicine that you have used, or anything that you have used, including herbal products and supplements. Some people come to hospital and when they are in the hospital, they don't want to tell the doctor there is this herbal medicine that I'm using because maybe he thinks that it's not appropriate to tell the doctor. May God have his wrath on them. But they think it is not appropriate to tell the doctor that I'm using a herbal medicine. Tell the doctor that there is this herbal medicine that I'm using and it is this, so that it can help you. The doctor can help you how to get rid of the product, because different products have different interaction media. Avoid self-mixing medicine. You go to, like I've said, you go to the pharmacy, and when you are at the pharmacy, what you can do is you ask for Brufen, you ask for aspirin, NSAID plus aspirin, and then you start more bleeding and abdominal pain. It's not good. You avoid mixing medicine. That is not good. Read labels carefully of the medicine, and even when you go to a doctor's office and you have got your medicine from the pharmacy, Always read the instructions on the medicine and check the expiry date. I have ever experienced such. I remember sometimes when I was given an injection and it made me see a blackout. I could see, I could see anything. You could not see anything. Which medicine was that? Was it a painkiller or an antibiotic? There are some medicines that when you are given you start vomiting. There are some that you black out. Medicines like this medicine is called what? This medicine is called, there is one painkiller that when you are given you can black out. I'll remember, I'll tell you about it. Check, we have said warfarin plus NSAID, you'll get bleeding risk. Metformin, heavy alcohol use, dangerous. It is metformin is it reduces sugar levels, and then you take drugs. It can build very bad acid in your stomach. Sildenafil nitrate. Sildenafil, you know that? Sildenafil is a medicine that is used to people that have low blood pressures, and people use it when they want sexual enhancement. People use it when they want sexual enhancement. So when you are using it, and then you are using maybe heart medication that are called nitrates, it is dangerous. It is very dangerous. You can get a heart attack. That's why you hear some people when they have some men, when they have got someone outside their marriage. Cassandra, the drug that you used maybe was a painkiller and it was tramadol. Tramadol has a problem when it comes to getting blackouts, and as a ceftriaxone, sometimes vomiting. So my guys, you know, there are some things that when we talk about them, we need to follow up because they are matters of life. You have had so many people that have gone through problems that are bad. You go and take sildenafil because you have someone outside marriage in a lodging or in that person's home, and then you forget that you are on medications that are nitrates and they are heart medications. So when you are on those medications that are nitrates, they interact. Remember, the first thing is you did not tell that person that you are using nitrates or you have heart condition. So when you take them, before you start doing it, you collapse and die. And you have heard of all these things happening. They say that he was there and he took some medication and he got a heart attack. It is because of interactions over this, and these are mostly on the ages above 40 years. You have a heart condition, you are on nitrates, and then you are using sexual enhancers like sildenafil. Most of them just die even before doing what they wanted to do. So let's be careful on these issues. They are very important when it comes to life. We were talking about important topics. We have talked about alcohol and over-the-counter drugs. Let's stop taking alcohol, my friends. Let's stop taking alcohol when we are using drugs. And remember something, children doses are different from adult doses. For children, consult the doctor also, always. For children, always consult the doctor. If pregnant, breastfeeding, or having chronic illnesses, check with your healthcare provider. If you are pregnant, these are important parts in your life. if you are pregnant, breastfeeding, or chronic illnesses like diabetes, arthritis, and all those, consult your doctor first. Most the people that are pregnant, because some drugs that you are using when you are pregnant, they bypass the normal circulation and they go to the placenta, they go to the child. You see? So don't always, when you are pregnant, just don't buy drugs randomly. Don't buy drugs randomly. Always buy drugs when you have consulted your doctor. If symptoms are severe, persistent, or worsening, seek medical care. If the symptoms are persistent, don't say I've taken some Brufen and I'm getting better. No. Always seek doctors' advice and management, because people nowadays, what people do is they always Google and they check the signs and they know this. I've Googled, I've seen this sign and this sign. So let me go just to an over the counter at the pharmacy and buy. Or you see, you have been diarrheaing and you already know. I'm diarrheaing because maybe I took this drug, this food. So you Google, you go to artificial intelligence, and they tell you the drug that you can use. Then you go over the counter and buy. And some symptoms are diverse. Some symptoms are shared within. So you may go over the counter, and because they see it's an over the counter drug, they sell you, and the outcome becomes more worse. There are some conditions that can give you damage in the liver. The normal drugs like Brufen that you buy, the normal drugs like paracetamol, you Google, you go, you get them, and then they give you problems in your liver. You get to the pancreas, you have stones because of the blockage. The liver has a problem, and you are feeling like, always people say, I'm feeling like I'm having malaria. I'm feeling like my body is having malaria. That is a common word that is used here in Kenya and African countries. So you go to buy anti-malarial drugs, and these anti-malarial drugs, as they are metabolized, they pass through your liver, so you cause more damage to your liver, and maybe it's not malaria, it's another problem that is developing. So you make your conditions more worse. When you get to a hospital, the first thing the doctors do is they start treating. They start taking care of the problem you caused before starting to treat you, because they don't want to damage your organs more. This is why it is very important to consult a doctor before doing some things. And seeing the doctor physically is very important. Sometimes when people call me and say that I'm feeling this way and this way, I usually tell them, please visit your doctor where you are. Your doctor will do this and this, or go and see a doctor or health personnel that is around you. Let the health personnel examine you, and then we will discuss. Because some diseases conflate, and you can think that you are a doctor discussing with the patient on phone, thinking you are doing the best, but when you physically examine this person, you find that whatever that you are thinking is not what is there. Some women get spontaneous abortion, some induced by themselves. You get to the hospital, you are told I'm on menses, and then it becomes, it's not a mens, it's not menses, it is something else. So you as a doctor, you may get yourself in problems. Honestly, I used to go to the counter to get medicine and later realized that it was affecting my health. So my friends always go to hospital, get tested. So yes, very important. There are some countries that you cannot buy medicines over the counter. Even the people that are there, they fear selling medicines over the counter. But you will find others you can buy and they have no problem. So today I think that is good for the Sunday. If you have any questions, please ask. We can talk about anything else at night if we will have some time. You know, Sunday is our family day. People are preparing to go back to school. Here where it's an evening right now. Some people right now where they are in church. Others are going to church, others are in church. Sunday is a family day. Sunday is a family day, and that's why nowadays you see me having problems to come online on Sunday. Okay, I have the last question. Let me hear about the last question. What is that question, Cassandra? Let me hear about your last question. Or anyone else. Greetings, Kate. Greetings, Kate. Thanks for coming in. Okay, Cassandra says, I have a last question. Let me wait for Cassandra's question. So right now we understand why going to a doctor for consultation, even if it is let me see, even here, Dr. Benjamin, you can't go get those medications over the counter. Yes, and you know now the government is protecting its citizens. Those governments that have just left the pharmacies are giving drugs over the counter. Please look at your people. It's very important to manage medical things in a good way. You see, it's very important to manage medical things in a good way. Very important. It is very important, very, very important. So I'm waiting for that question of Cassandra or anyone else who have any question. If you have any question that you feel you can ask, we have talked about several things about medicine. Random questions today. Today is a Sunday. You see, a Sunday is an easy day, and sometimes it needs someone to rest and feel good. That's why today I've been sleeping, and I found myself sleeping at this time. At this time. So, guys, let's talk about Cassandra. Which question are you having? I'm waiting for you, or anyone else who has any question that can ask. But we have said now, drug interaction, counter drugs. The worst is buying over the counter and you get drug interaction. That is the worst. Buying over the counter and you buy you buy over the counter, you get drug interaction. That is a very bad thing. See, it is a very bad thing. Very bad thing. Now, let me see. Does generic tablets and real work the same? Generic tablets. This is a very nice question, Cassandra. And I don't know if all the governments are some welcome FRC. Today is just a random question and explanation. We have been talking about drugs interaction and some things I think you will watch. If you have let's say amoxicillin, generic and the original, they work the same. It is amoxicillin, same active ingredient, same strength, same form of tablet or capsule. They work the same. The problem comes in, you can get some generic tablets that have additives. They have some sugars, they have some additives that make you not to have problems. They work the same. The only problem, most of the original tablets are bitter because they are nothing, they have nothing, they have not been added anything. It is just the tablet itself. If it is an antibiotic called amoxil, it is amoxil. But when it comes to generic tablets, you will find that they are upgrading it's the tablet. They are using some additives like sweeteners, so that if a person uses them, he feels better, not the bitterness. So they work the same, but some people may be having problems with the additives that are being added. The additives that are being added. And you may find when you take an original tablet, you are not getting a problem. When you get an original tablet, you are not getting a problem. But when you get the other a generic tablet, you start having problems because of the additives that have been added to that tablet. You get? So they work the same. If you don't have any problem with the additives, just use the generic. But that one I leave to the doctor's prescription, the one who is helping you to recover. You see. So guys, that is it. Hope, Cassandra, you have understood about it. Hope you have understood about it and about these drugs also. Sometimes you can have issues with the generic. It's not the drug, it is the added ingredients, because different companies have different ways they create their components. So welcome everyone, welcome FRC, welcome Kate, welcome Jamaican Uncle, everyone who has been in the chat, and everyone who has been here. Unless anyone who has any question, it's been 1.5 hours. We are going to 1.5 hours. Let's see, the 8 minutes. Anyone who has a question can ask. And the new people that has been in the chat, thank you so much for being here and subscribing too. You see, thank you so much for your subscription and being in the chat. So it's a Sunday, and Sunday is an easy day. Sunday is an easy day. We don't have so many things to do on Sunday. Sunday, people need to relax. People need to feel easy. People need to feel that they are good. You see, no complications, no issues. So today we didn't have any topic that was straight. We just had a random question type that we were dealing with. If you have a question, let me leave myself. If you have a question, ask. You type it before I come in a minute, so that I can answer it before I leave. So type any question that you have. they have to add the additives. Or the additives are there because some drugs are very bitter, uncle. Some drugs are very bitter, and sometimes when you take them you feel bitterness and people don't like. So some companies make them, you can find they make them tasty so that you feel good when you are taking them. Or they add some products that they can make them so effective. When you take the drug, it is absorbed faster. You see, like paracetamol. There are some paracetamols that have been added some things like Optizol. When you take them, they do what? They are absorbed so faster. So they add the efficacy. But you see, some people can react to those additives. Not everyone. But before they are done, they have to pass through the QC, quality check, and so many things. So that is why the additives are added to those drugs, to several drugs, several drugs. So it's not that they want to destroy the drug, no. It is making more effective. And some companies, the mother companies of a drug, because when you have a drug, it's the mother companies, they can sell their rights to another company. They can sell their rights to other company. And when they say their rights to other company, the company has rights to modify the drug. And that is what happens. So that's why you will get a drug from Pfizer, you'll get several companies, and you have seen them. The same drug from different companies, you see. So that is what happens, Jamaican uncle. Any other question? Who has any other question that we can talk about? That's an important question. Why do they have to add? That is a very important question. Very important question. Any other question before I log out and we meet at Jamaican's uncle place in the evening? Any other question from anyone? Yes, I can see there is no more question. So have a lovely Sunday, my guys. Those that are going to church, those that are going to church, be blessed. Have a nice day. We will meet in the evening or tomorrow. I'll come back for more questions at 9, 6, 7, 8, 9, 2 hours and a half from now. Bye bye. See you guys. Be blessed.